Prescription drug prices are a top election issue. Many Americans feel it should be Congress's top priority. Chloe Nordquist taking a look at how those costs are forcing families to make some difficult decisions.
When I was diagnosed in 1972, insulin cost about $1 a bottle. There I am with a bottle of insulin and a syringe.
The price tag now, about $350. Insulin helps diabetics manage their blood sugar.
So this is my current blood sugar. My name is Gail DeVore. I have had type 1 diabetes for almost 48 years.
Her childhood doctor told her she wouldn't live past 40. She recently turned 59. Diabetics often have to buy multiple bottles of insulin at a time. For someone with a high deductible prescription plan, that comes right out of their pocket.
To afford that, which just happens to be more than my own mortgage, it's unreachable for some families.
The CDC estimates around 30 million people in America have diabetes, almost 10% of the population. The national price of insulin increased from around $340 in 2012 to $666 in 2016.
It's the most expensive part of our lives. My name's Michelle Fenner.
Her 17-year-old son was diagnosed with type 1 diabetes 9 years ago.
It impacts our ability to save for retirement. We've had to pull money out of savings.
Insulin isn't the only medication with a rising price tag. Michelle was diagnosed with an autoimmune disease just a year ago. Her medication alone can cost over $2,000 a month.
As I'm trying to keep my son alive and pay for all his costs, am I going to be able to afford my medication?
Overall, drug prices have continued to increase. My name is Gina Moore. I'm currently the president of Colorado Pharmacists Society. We're all touched personally by the cost of medications. My husband, as an example, was diagnosed with Parkinson's disease a couple months ago.
Individual spending on prescription medication increased from around $251 billion in 2012 to $341 billion in 2016.
It's not necessarily a new problem, but it's really one that has been magnified over the course of the last decade.
Income for pharmacies from retail prescription drugs went up from nearly $31 billion in 2012 to $77 billion in 2016.
Don't hesitate to ask your pharmacist if they know of less expensive alternatives.
But for diabetics, there are no alternative drugs.
It's this simple little tiny hormone that every body should make. And without it, we die.
How can you plan your life when you literally have no idea how much something is going to cost?
For The Race, I'm Chloe Nordquist.
People are leaving the country to get cheaper healthcare. We're taking a look at medical tourism next.